Hello, Dr. Pettis and my fellow anonymous. I just want to hop on, and I hope this doesn't count towards my 2.5 minutes, but I just want to say thank you for a great semester and a great anatomy class. I have learned so much, and this has just been the best. So here's objective 4. It's my last one, and it's all the muscles of the leg. Next, we're going to go into different compartments of the leg. So first is the anterior, and it's innervated by the deep fibular nerve, and its action is to dorsiflex the ankle. So highlighted here is the tibialis anterior, and then the extensor hallucis longus, and the extensor digitorum longus. Next, we're going to go into the lateral compartment, which is innervated by the superficial fibular nerve, and its action is to avert the foot, and it is a weak plantar flexor. So first is the fibularis longus, and you can even see here how the tendon runs under the foot. And then the other muscle is right here, which is the fibularis brevis. Lastly is the posterior compartment, which is innervated by the tibial nerve, and its main action is to plantar flex. So we're first going to do the superficial muscles. So here is the gastrocnemius, and this is the Achilles tendon, so we're just going to dissect both of those out. And then is the soleus muscle, and then there's also the plantaris, which is up here, the big long tendon that contributes to the Achilles tendon. And then deeper, we have the popliteus, which is right there. And then this one, so how we can remember the order is that the medial malleolus is Tom, which is right here first, which is the tibialis posterior. Dick, which is the flexor digitorum longus. And then Harry, which is the flexor hallucis longus. Because of these different compartments that these muscles are in, there can be an increased pressure within the fascias that surround them from blood or swelling. So even right here, you can see the leg is swollen in both of these. And this is called compartment syndrome. So it affects circulation and it threatens the function and viability of these tissues. And you can see too here, swollen muscle compresses these blood vessels and nerves of the leg. Next, we're going to talk about the sensory innervation of the leg and the foot. So first, highlighted, we have the sural nerve, which is innervates the posterior and the lateral, and it's from the tibial/common fibular nerve. And next, we have the superficial fibular nerve, which is the distal 1/3 anterior leg in the foot dorsum. Next is the deep fibular nerve, which is the first interdigital cleft. And then we have the medial plantar nerve, which is the medial plantar foot and 3.5 digits, and then the lateral plantar is the lateral plantar foot, and there's also calcaneal branches, which is the skin of the heel. Last is the saphaceous nerve, which is innervates the anterior/medial leg, and it's from the femoral nerve.